This presentation is to discuss domestic violence identification and intervention within the healthcare setting, and how technology can be used to aid professionals in utilizing screening tools to assist in identifying domestic violence victims. Domestic violence is very common in the United States. 1 in 5 women and 1 in 7 men have been victims of domestic violence at some point in their life. 1 out of 15 children have been exposed to domestic violence in some capacity. And domestic violence is linked to both physical and mental illness. Victims of domestic violence are more likely to suffer from sexually transmitted illnesses and chronic diseases than the general population, and women who are victims of domestic violence are more likely to suffer from depression and suicidal ideation. So since domestic violence victims are typically harmed in some physical capacity, healthcare settings are likely to see these victims. Emergency departments being the highest volume, where victims would go to be treated for any incident of their abuse. And since victims of domestic violence are being seen in the healthcare setting, it is appropriate for practitioners to be provided with tools that will help them to identify domestic violence victims. One study in 2012 discussed that victims of domestic violence are more likely to disclose their abuse when they are directly asked by practitioners about their history of abuse. So in the healthcare setting, we often ask, how can we identify domestic violence victims? As of now, there is no universal method used in the healthcare setting to identify domestic violence victims. So one of the tools we could use would be to universalize domestic violence identification tools so that we can increase the number of victims who are identified by healthcare professionals. With an increase in identified victims, there would also be an increase in the provision of interventions given to those victims. Technology will be crucial in the development of this universal screening, and because right now not all healthcare settings are utilizing technology in their identification tools. Some hospitals may be using computer systems or their medical record systems to screen for domestic violence, but many healthcare settings are relying on the practitioner's ability to identify symptomology, the outcry of the patient, or just intuition that something isn't right. So technology could be used to implement software into the electronic medical chart that would prompt providers to ask specific questions about domestic violence or any type of abuse. The internet would also be used for training resources that would educate practitioners on domestic violence screening tools, as well as symptoms of domestic. So all in all, technology will be a very great addition to universalizing domestic violence screening tools.